My name is Princess McGriff. I'm a nurse practitioner here at Georgia Urology. My job entails seeing patients for maybe overactive bladder, kidney stones, bladder cancer, prostate cancer, bladder infections. So I was trained as a family nurse practitioner. So I was trained in pretty much everything from anywhere from the wound to, the elderly. I started working in urology because one, you don't see a lot of females in urology. And another reason is because my background was oncology, and in urology, you get a little oncology, but you get a lot more of other things as well. So it's an even balance. What I love about my job most is being able to see different patients with multiple different diagnoses and being able to see patients sometimes in their most vulnerable moments. I have one particular patient that I started seeing maybe last year, kind of shortly after I started, and that patient was sent here because she was having multiple bladder infections. The patient was very frustrated. She felt really down about herself. She stopped leaving her home, would not go to family events because of these random bladder infections that she would have and some of her urinary symptoms. So after seeing the patient, doing some education and kind of figuring out different things that was going on, that was happening, we were able to start a treatment that worked really well with the patient. She stopped having infections. We recently had a follow-up, and she hasn't had a bladder infection within the last 4 to 5 months. That makes me feel like I was a great attribute to her life, because now she just came back from a trip recently with her grandkids. She didn't have to worry about staying home because she would have these increased urgency or this increased pain, with the urination. So it made me feel really good that I was able to help her.